Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A 16-month-old child diagnosed with Kawasaki disease is very irritable, refuses to eat, and exhibits peeling skin on the hands and feet. The nurse should do which of the following first? 1. Apply lotion to the hands and feet. 2. Offer food the toddler likes. 3. Place the toddler in a quiet environment. 4. Encourage the parents to get some rest. The correct answer is 3. One of the characteristics of children with KD is irritability. They are often inconsolable. Placing the child in a quiet environment may help quiet the child and reduce the workload of the heart. Although peeling of the skin occurs with KD, the child's irritability takes priority over applying lotion to the hands and feet. Children with KD usually are not hungry and do not eat well regardless of what is served. There is no indication that the parents need rest. Additionally, in this situation, the child takes priority over the parents. A preemie gravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated. Although the application of cool compresses may ease the pain temporarily, this would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. A client has had hoarseness for more than 2 weeks. The nurse should 1. Refer the client to a healthcare provider for a prescription for an antibiotic. 2. Instruct the client to gargle with salt water at home. 3. Assess the client for dysphagia. 4. Instruct the client to take a throat analgesic. The correct answer is 3. Hoarseness occurring longer than 2 weeks is a warning sign of laryngeal cancer. The nurse should first assess other signs, such as a lump in the neck or throat, persistent sore throat or cough, earache, pain, and difficulty swallowing. Gargling with salt water may lead to increased irritation. There is no indication of infection warranting an antibiotic. An oral analgesic will provide only temporary relief of discomfort if hoarseness is accompanied by a sore throat. A client diagnosed with asthma has been prescribed fluticasone 1 puff every 12 hours per inhaler. Place in correct order the statements the nurse would use when teaching the client how to properly use the inhaler with a spacer. 1. Hold your breath for at least 10 seconds, then breathe in and out slowly. 2. Take off the cap and shake the inhaler. 3. Rinse your mouth. 4. Breathe out all of your air. Hold the mouthpiece of your inhaler and spacer between your teeth with your lips closed around it. 5. Press down on the inhaler once and breathe in slowly. 6. Attach the spacer. The correct order is 2, 6, 4, 5, 1, and 3. Using a spacer, especially with an inhaled corticosteroid, can make it easier for medication to reach the lungs. It can also prevent excess medication remaining in the mouth and throat, where it can lead to minor irritation. It is important for the client to empty the lungs, breathe in slowly, and hold breath in order to draw as much medication into the lungs as possible. Rinsing after using a corticosteroid inhaler may help prevent irritation and infection, Rinsing will also reduce the amount of drugs swallowed and absorbed systemically. The mother of a child hospitalized with tetralogy of Fallot tells the nurse that the child's 3-year-old sibling has become quiet and shy and demonstrates more than a usual amount of genital curiosity since this child's hospitalization. The nurse should tell the mother, 1. This behavior is very typical for a 3-year-old. 2. This may be how your child expresses feeling a need for attention. 3. This may be an indication that your child might feel responsible. 4. This may be a sign of depression in your child. The correct answer is 2. According to Erickson, the central psychosocial task of a preschooler is to develop a sense of industry versus guilt. Any environmental situation may affect the child. In this situation, the sibling is probably feeling less attention from the mother and trying to resolve the conflict in an inappropriate way. 3-year-olds are usually active and outgoing. These behaviors represent a change. Symptoms of depression would include withdrawal and fatigue. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Good dental care is an important measure in reducing the risk of endocarditis. A teaching plan to promote good dental care in a client with mitral stenosis should include instructing the client to do which of the following? Select all that apply. 1. Brush the teeth at least twice a day. 2. Avoid use of an electric toothbrush. 3. Take an antibiotic prior to oral surgery. 4. Floss the teeth at least once a day. 5. Have regular dental checkups. 6. Rinse the mouth with an antibiotic mouthwash once a day. The correct answers are 1, 4, and 5. Daily dental care, including brushing the teeth twice a day and flossing once a day and frequent checkups by a dentist who is informed about the client's condition, are required to maintain good oral health. The client can use a regular toothbrush. It is not necessary to avoid use of an electric toothbrush. Taking antibiotics prior to certain dental procedures is recommended only if the client has a prosthetic valve or heart transplant. It is not necessary to use an antibiotic mouthwash. A client experiencing a severe asthma attack has the following arterial blood gas results: pH 7.33, PCO2, 48 PO2, 58 HCO3, 26. Which of the following prescriptions should the nurse perform first? 1. Albuterol nebulizer. 2. Chest X-ray. 3. Ipratropium inhaler. 4. Sputum culture. The correct answer is 1. The arterial blood gas reveals a respiratory acidosis with hypoxia. A quick-acting bronchodilator, albuterol, should be administered via nebulizer to improve gas exchange. Ipratropium is a maintenance treatment for bronchospasm that can be used with albuterol. A chest X-ray and sputum sample can be obtained once the client is stable. An 18-month-old with congenital heart defect is to receive digoxin twice a day. The nurse should instruct the parents about which of the following? 1. Digoxin enables the heart to pump more effectively with a slower and more regular rhythm. 2. Signs of toxicity include loss of appetite, vomiting, increased pulse, and visual disturbances. 3. Digoxin is absorbed better if taken with meals. 4. If the child vomits within 15 minutes of administration, the dosage should be repeated. The correct answer is 1. Digoxin's effect is to slow the rate of the electrical conduction to the heart and increase the strength of the heart's contraction. Signs of toxicity include anorexia and decreased heart rate. Digoxin should be taken 1 hour before meals or 2 hours after meals in order to obtain better absorption of the drug. If the child vomits within 15 minutes of administration, the dose should not be repeated because it is not known how much of the medication has been absorbed. A client is scheduled for a cardiac catheterization. The nurse should do which of the following pre-procedure tasks? Select all that apply. 1. Administer all prescribed oral medications. 2. Check for iodine sensitivity. 3. Verify that written consent has been obtained. 4. Withhold food and oral fluids before the procedure. 5. Insert a urinary drainage catheter. The correct answers are 2, 3, and 4. For clients scheduled for a cardiac catheterization, it is important to assess for iodine sensitivity, verify written consent, and instruct the client to take nothing by mouth for 6 to 18 hours before the procedure. Oral medications are withheld unless specifically prescribed. A urinary drainage catheter is rarely required for this procedure. A client arterial blood gas values are as follows: pH 7.31, PaO2 80 millimeters of mercury, PaCO2 65, HCO3 36 milliequivalents per liter. The nurse should assess the client for 1. Cyanosis, 2. Flushed skin, 3. Irritability, 4. Anxiety. The correct answer is 2. The high PaCO2 level causes flushing due to vasodilation. The client also becomes drowsy and lethargic because carbon dioxide has a depressant effect on the central nervous system. Cyanosis is a sign of hypoxia. Irritability and anxiety are not common with a PaCO2 level of 65, but are associated with hypoxia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse should caution sexually active female clients taking isoniazid, INH, that the drug has which of the following effects? 1. Increases the risk of vaginal infection. 2. Has mutagenic effects on ova. 3. Decreases the effectiveness of hormonal contraceptives. 4. Inhibits ovulation. The correct answer is 3. INH interferes with the effectiveness of hormonal contraceptives, and female clients of childbearing age should be counseled to use an alternative form of birth control while taking the drug. INH does not increase the risk of vaginal infection, nor does it affect the ova or ovulation. The nurse should teach the client that signs of digoxin toxicity include which of the following? 1. Rash over the chest and back. 2. Increased appetite. 3. Visual disturbances, such as seeing yellow spots. 4. Elevated blood pressure. The correct answer is 3. Colored vision and seeing yellow spots are symptoms of digoxin toxicity. Abdominal pain, anorexia, nausea, and vomiting are other common symptoms of digoxin toxicity. Additional signs of toxicity include arrhythmias, such as atrial fibrillation or bradycardia. Rash, increased appetite, and elevated blood pressure are not associated with digoxin toxicity. When planning care for a client with schizophrenia who lacks motivation to shower and dress, which of the following outcomes should the nurse expect the client to achieve by the end of 4 days? 1. Verbalize the need to shower and dress herself. 2. Recognize the need to shower and dress herself. 3. Explain reasons for showering and dressing herself. 4. Perform showering and dressing for herself. The correct answer is 4. By the end of 4 days, the client should be able to perform showering and dressing for herself. The client with schizophrenia commonly appears to be apathetic and lack initiative. Therefore, demonstrating the ability to complete the tasks indicates improvement. Although the client may be able to recognize, verbalize, or explain the need to shower and dress herself, she may be unable to do so because of the ambivalence associated with schizophrenia that impedes the client's ability to initiate and complete self-care. Therefore, evidence of improvement would be lacking. The nurse should teach clients that the most common route of transmitting tubercle bacilli from person to person is through contaminated 1. Dust particles. 2. Droplet nuclei. 3. Water. 4. Eating utensils. The correct answer is 2. Tubercle bacilli are spread by airborne droplet nuclei. Droplet nuclei are the residue of evaporated droplets containing the bacilli, which remain suspended and are circulated in the air. Dust particles and water do not spread tubercle bacilli. Tuberculosis is not spread by eating utensils, dishes, or other fomites. The nurse should assess the client with left-sided heart failure, for which the following? Select all that apply. 1. Dyspnea. 2. Jugular vein distension. 3. Crackles. 4. Right upper quadrant pain. 5. Oliguria. 6. Decreased oxygen saturation levels. The correct answers are 1, 3, 5, and 6. Dyspnea, crackles, oliguria, and decreased oxygen saturation are signs and symptoms related to pulmonary congestion and inadequate tissue perfusion associated with left-sided heart failure. JVD and right upper quadrant pain, along with ascites and edema, are usually associated with congestion of the peripheral tissues and viscera in right-sided heart failure. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.